to healthcare, which is going to be a huge topic. Is there room for private health insurance in your vision of the ideal American healthcare system?
So let's start with the battle we're having right now and talk about the things we need to be doing, because I don't want to lose sight of this.
Okay.
It's good to talk about our overall goal, and here's our overall goal. This is what distinguishes Democrats from Republicans. Democrats believe health care is a basic human right, and we fight for basic human rights. Our obligation is to make sure that everybody gets coverage at the lowest possible cost to all of us. So what does that mean? Right now, it means fighting the Republicans who are trying to sabotage the Affordable Care Act. We've got this lawsuit going on down in Texas where the Republicans are trying to do what they couldn't do with the votes, and that is trying to repeal the Affordable Care Act, to make it okay to discriminate against people with pre-existing conditions, to cut off access to health care for millions of Americans. So job number one is to defend the Affordable Care Act. Job number two is to make changes where we need to make them right now. Changes to hold insurance companies accountable when they're trying to cheat people, when they're trying to scam people. Changes right now in what's happening with drugs, prescription drugs. We need to lower the cost of prescription drugs. 1 in 4 Americans say they can't take drugs that are prescribed to them because they can't afford to pay for them. I have, for example, here, a proposal for generic drugs, which are about 90% of all the prescriptions that people fill, to be able to bring those costs down to just a nominal cost. And the third, how do we get universal coverage? Medicare for all. Lots of paths for how to do that. But we know where we are aiming, and that is that every American has health care at a price that they can afford, and that the overall costs in the system are held as low as possible.
But right now, your vision for Medicare for all, would it all be a public option, or would it include private insurance?
So right now, we've got there are multiple bills on the floor in the United States Senate. I've signed on to Medicare for all. I've signed on to another one that gives an option for buying into Medicaid. There are different ways we can get there, but the key has to be always keep the center of the bullseye in mind, and that is affordable health care for every American.